Keloid is one of the most common concerns in some individuals where you have a keloid tendency. You must have heard this term very normally. It is a overly grown scar tissue. Sometimes people can have it in the ears, especially after ear prick. Suddenly ears started growing big. And you must have seen some others also. So it will go really big size. It can be small peanut size too. It can go up to almost of a lemon size. So, and it will start irritating, itching, and it is also seen in midline, especially people who have underwent some surgeries, sternotomies. So all these people, they start developing some itching post-surgery, 3 to 4 months time later, and after that they'll start seeing that small growth which is happening on the scar. It's also called keloid. So this, how do you treat this keloid and what is it? Do you really you have any treatment for this? So this is quite a common concern in people who have a keloid tendency. It can be seen in the midline, especially people who have a surgeries in the midline or ears, earlobes, and people who have a tendency wherever there is an injury, body overgrows there. So basically what happens when there is an injury, your injury healing, inflammation should happen and it heals and should stop there. But whereas in the people who have got a keloid tendency, the scarring tissue grows over it like a heap. So like a line, if you have, let's say if your skin is cut like this, it grows like a worm. It go above the scar. Usually this growth starts after the first month of injury and it grows till to 6 to 7 months. And especially, if you consult your doctor in the initial stages, we have treatments like silicone sheets and some creams, actually heparin based creams. So with the creams, if you massage them regularly and apply the silicone sheet comfortably, then naturally the scar gets suppressed. So this can be prevented. People who are already established keloids, so let's say you already got a keloid and you didn't know that there's a keloid, it is there. So does this surgery help? No, actually a keloid, because body is responding very aggressively for an injury, even a surgery is also injury. So surgical removal of keloid is a last choice that we do only if there is a recurrently getting infected or there's a hair inside or it is not making your body move. Let's say something got stuck, so we release it. Otherwise, surgery is a last option for keloid. We treat keloids with multiple injections. Sometimes we use intralesional steroids, something called Kinocort, or we use 5-fluorouracil or bleomycin. These are one of the few of the drugs we use either individually or in combination to treat this keloid, and it is not one time. Based on the size of keloid, you may have to visit your doctor, surgeon, once in a month, sometimes once in 3 weeks, based on the dosage they are giving. You may have to visit 6 to 7 times. In between, every monthly once, it might take you 5 to 10 minutes of time, but slowly it resolves. The growth, slowly it fades. It's become flat, maybe 6 to 7 months time. In addition to injections, we also have fractional lasers, which is called CO2 laser, and where we treat that keloid with a laser, and we give steroid based creams or lotions or ointment to suppress that growth. So surgery of keloid is a last choice. Injection based treatments are the first choice. We also do cryo treatment where if there's a long keloid, we use cryo probe to destroy the keloid, and that also requires multiple sessions. It can be steroid based or 5-fluorouracil based ablation or cryo ablation. Sometimes we use RF energy. RF based energy, we drill through keloid and we burn it. So basically we are removing that excessively grown tissue by various other means, but not surgery. If it is a very big growth on the ear, sometimes we opt surgery and we inform that the keloid can come back. Knowing that all the risk and prognosis, we instantly on the table we start giving steroid injections after surgery, and we might ask them every month, 3 to 4 months time, not to start the keloid process again. If you're going through surgery by any reason, make sure that your doctor will follow you up closely to stop the further keloid formation. This is very, very important. So if you have a keloid, don't worry. and your doctor will help you to suppress it, address it with medical management and some injection based treatments and some silicone gel sheets. Radiotherapy is one of the common, if your doctor is a has a hospital has a radiation department, sometimes radiation also is one of the cure for a keloid, but since it is not available everywhere, the injection based treatments are very common for this keloid treatment. So if you have more questions about keloid, you can always reach us at the address given on the clip link, and you really don't need to worry. We have a 100% safe and safe way to address keloid, and there's no cure, but we can definitely treat it well with all the above said treatments. Thank you very much.